Right. The Glasgow Coma scale is used to determine a patient's level of consciousness. And so we're going to go through the steps of the Glasgow Coma scale to look at their eyes, their verbal communications, and their motor. It's important for us to check to make sure that they are able to respond to us, whether that is like having a hearing deficit, swelling of the eye, things where they're not going to be able to respond to us, as well as for motor, their sensory, making sure that they can feel our touch. So to begin, I'll knock to enter the room, and then I'd observe before speaking to the patient. And so during the observation, I'd see if she spontaneously looks at me. And so she isn't looking at me, so then I would address the patient. Hi, Kaya. My name is Erin. I'm a student at Midwestern University. Can you please open your eyes for me? And she isn't responding, so I'd speak a little bit louder. Kaya, this is Erin from Midwestern University. Can you please open your eyes for me? And so it's important to verbally address them before physically giving them a stimulus. So she's not responding. So I would give a physical stimulus by putting pressure on her fingernail. And so I'd give her pressure, and I'd hold it there for 10 seconds, up to 10 seconds, and there's no response, going from low to high pressure. And so there's still no response. And so I would rate her as a 1 on the scale, and for eye opening, because there is no response to eye opening. I'm going to assess verbal now. Can you tell me your name, where you are, and what day of the month it is? And so since there's no response, I would grade her as a 1 because there's no response. If she were to answer those questions correctly, she would be oriented, which would be a 5. If she were to say sentences back to me and make sense, but she's unable to answer the questions correctly, she would be confused, and which is a 4. And then if she were to just respond with words that don't really have an order or make sense, then she would be labeled as a 3 for words. And then if she just responded with moaning or groaning, then it would be a 2. All right, so now we're going to assess motor response. And before asking the patient, I would make sure that they're able to they're able to move, and that they don't have like a spinal cord injury that would make them not able to move. So Kaya, can you hold my hand and let go? And so I'm asking her to do a 2-step command. If she was unable to move her arms, I'd ask her to open her mouth and stick out her tongue. And so she's not responding, so that would be so it wouldn't be a 6 for follows 2-step commands. And then next I would give a central physical stimulation by putting pressure on her upper trap. And so I put pressure there, and I'll go from moderate to intense stimulation for about 10 seconds. There's no response, so I'm looking there for her to localize to her trap by bringing her arm above her clavicle. If she were to do that, it would be a 5 for localizing. Since she didn't respond to the central stimulus, I'll give a peripheral stimulus on her fingertip, similar as we did before. So I'll put pressure onto her finger. Let's see, 10 seconds, there's no response. So if she were to flex away from her body and from the stimulus, then that would be a normal flexion response, which is a 4. If she were to slowly flex in towards her body, then that would be a 3 for an abnormal flexion response. And then lastly, if she were to extend her elbow, then that would be a 2. So since there is no response, she is labeled as a 1 for motor because there's no response. And if she didn't have any motor control, then that would be non-testable. And so with a total of all the eye-opening, verbal, and motor, since she scored 1 on all of those, it would be a 3 total for her score. And in documentation, we would say exactly what her response was and what we did to try to elicit the response.